Let's talk osteoarthritis out of the gates. A lot of people suffering from this. One of the multiple types of arthritis. This one's usually the joint is deteriorating, breaking down, damaged. You can think, the easiest I think is from a spine where, there's the nice pads in between each vertebrae of your spine, and those are thinning out. Nasty form of it, because when those pads thin out, the holes that the nerves come out of get smaller and smaller. And if you crush the nerves, that's what's controlling you. So we can't do that. Same thing can happen though. The knee, very common, where there's, we use the term bone on bone. It's not actually that the bones are rubbing together, but that space is deteriorating, right? There's less padding in there to protect you. Two little pads, one on the outside, one on the inside of your knee. It's a common area of it. A lot of people deal with it also in the wrists because of typing constantly, because of, maybe you have a job where you're gripping or you're grabbing all the time and constantly have to use your hands. I have a gentleman, patient for years, and he's a wood turner. And so he uses that force to turn the wood and to use, whatever apparatus he's using to chisel, carve the wood, form it, shape it. But man, has it created a lot of osteoarthritis in his hands. So whatever joint you have it in, let's talk about remedies to address it. So this is going to be one, the space is getting beat up, damaged, and wore down. So I always go to the cause first. How can we improve your joint health? How can we minimize the damage of why are the tires out of alignment on the car in the first place? Let's put them back into alignment. So for this part, if it's a spinal injury, highly would recommend seeking chiropractic care, getting a before x-ray to identify the areas that are actually degenerated, figure out why those vertebrae are out of alignment or not moving properly, because that's what's creating the osteoarthritis. That's when I would address it. If it is in the lower extremities, I would really take a good, honest look at your weight. Mayo Clinic did a study proving that 1 pound of weight here creates 4 pounds of weight down there on your knees or your ankles or your feet. So if you do have arthritic conditions in the hips, knees, or lower extremities, weight is a massive factor. Now, then I would come in working our way back up. If it is one knee and not the other, if it is one foot and not the other, if it's more prominent on one side or the other in your lower extremities, maybe there's a pelvic misalignment, which would take you back to analyzing the hips through a proper x-ray. And if they are tilted, now the tires are out of alignment and you're going to wear down the right knee faster than the left knee. Make sense? So that is the kind of looking at the cause. Now the upper body, my mom, for example, gets a lot of stiffness, a lot of joint pain, especially in the wrists. So we got to start breaking down, okay, where could this be coming from? When you're looking at the upper extremities, you're looking all the way down the chain of command. So the message has to come from your brain to tell your finger how to move. Go ahead and move your finger for me. So for your brain to send a message to your finger right now, the nerve has to go all the way down through each of those joints. So you could have a problem in the neck. Okay, C point number 1, if that's the case. Then we want to look at the shoulder. Maybe you're sleeping on it too often. I had this for a little bit. I had to be very aware of how I was sleeping and make sure I was getting on my back more. I know you're not a back sleeper, but I get in that position more. And then you could move down to the elbow. There could be problems and issues there, or the wrist. So for any of these issues on drlivingood.com, we have rehab for the tendons and the muscles that cross these joints. Wrist, thumb, elbow, shoulder, neck, base of the neck, hips, knees, ankles, plantar. All of them. So if you have an area of damage of stiffness, joint stiffness, known arthritis in a joint, you've got to rehab it. Now, it seems a bit counterintuitive to put more motion into a joint that is wore down. That's exactly what it needs. It needs to have optimized blood flow. No better way than to make sure you're helping out the muscles that cross that joint that are helping it move in the first place. So that's going to minimize a lot of stiffness. So when my mom was here recently, we worked on the neck area and the wrist. She was doing a lot better right away. So I gave her some specific exercises that are on drlivingood.com for the wrist. So you just search for the area that you have damage: wrist, elbow, shoulder. There's one for the front of the shoulder, back of the shoulder. That will help it, okay, to get that movement back in. So we've looked at positioning of your spine, pelvis. That could be throwing things off. We looked at weight, which is massive for the lower extremities. For the upper extremities, rehabbing the entire chain to find the source. It might be hurting here, but it could be coming from up here. So be aware of all of those. Now let's get into practical. Okay, so that's putting motion, stretching, and movement back in, which is absolutely essential. Getting the weight off, absolutely essential. How the nutrition goes. So nutritionally eating for osteoarthritis means you're eating. It's an itis. Anything with an itis means inflammation. So we want a very anti-inflammatory approach for this. Anything going in your mouth is going to add to the fire or be water to put the fire out. So there's a breakdown of this in the Livingood Daily Lifestyle members area. There's an entire workbook on it. The Make Food Simple book has a food list for things that are inflammatory and things that are not. But the Livingood Daily book is still a good guide too, as far as it's going to cut down a lot of carbohydrates, which create inflammation. But I would look at the Make Food Simple book and get your kind of a breakdown of eating that way. Now, what else can you take in to minimize the itis, the inflammation? My two favorite, the most readily available and clinically powerful anti-inflammatories that don't cause holes in your stomach, that don't damage your gut lining, that don't create other side effects that NSAIDs do, like aspirin and Motrin and Advil, the combination of omega and turmeric. So many years ago, we went down the road and studied omegas, their impact on your blood, their impact on heart, their impact on inflammation. It was found that if you take 1,500 milligrams of a high quality omega-3, you actually get the same pain relieving effect as an NSAID. That's the aspirin or the Motrin or the Advil. So that was a dominant study to look at the impact of lowering inflammation. And then we throw turmeric in there, which has hundreds of studies on its anti-inflammatory effects of the body. So those two in combination, I put them together in the same supplement so that you don't have to buy two of them. You just get one. That's how I like to take it. Like, just can we fit it in? Can we fit more into one pill? Sometimes it's not always that easy, but in this scenario, we were able to, because the technology from the gentleman that actually discovered omega-3s concentrates the omega-3, the highest level on the market, and then we're able to get the most concentrated form of turmeric, put them together. So that's what I would suggest. Those are on the store. So that's osteoarthritis. You've got to get the joints moving, address more than just the one joint, look at the joints around it, get your weight under control, check your alignment, eat an anti-inflammatory approach, use omega and turmeric. There it is. If you need help with it, grab one of the books as a guide to get you started.